waiting for the world to help. But in one of Yemen's most isolated regions, aid may never arrive. Already besieged by war, people here are facing another unforgiving enemy, cholera. For months it has preyed on the most vulnerable, the frail and the weak, and it has now spread across almost the entire country. In this family, 7 children have contracted the disease.
I
swear to God, I'm helpless. I'm penniless. I had to borrow money from some neighbours to treat my children. One of them died. We are all in God's hands.
After years of fighting, access to clean water is hard to find, and even when available, is also a potential killer. 250,000 people are suspected of contracting cholera. Since April, the numbers being diagnosed has sharply increased. And even though people in this village suspect the water is contaminated, it is their only source. 20 villagers have already lost their lives after drinking it, and many more are sick.
The baby is suffering from diarrhea and vomiting and on medicine now, but it hasn't stopped. We really need help.
60 kilometres away, the sanctuary of a hospital offers little hope. Here too, life hangs in the balance. Every day, new patients arrive, weak from diarrhea and malnutrition. The hospital, already crippled by years of war, is overwhelmed, and there are calls for more international action.
Every single minute, 1 new child is reporting sick with acute watery diarrhea. To the Yemeni authorities and Yemeni people themselves, more needs to be done to really help Yemen tackle this crisis.
The conflict in Yemen has now gone on for more than 2 years, and government forces, backed by a Saudi-led coalition, continue the fight with Houthi rebels. It has made Yemen even poorer, and in no state to deal with this latest health emergency. Cholera may be cheap and easy to treat, but a country already broken by war and hunger is unable to cope. Duncan, Crawford, Al Jazeera.